Good afternoon and welcome to the Association of the United States Army's Thought Leader webinar. Thanks for joining us today. We really do appreciate your support. You know, America's Army faces many challenges: COVID, modernization, maintaining readiness for an ever increasing array of missions, and of course, the continual challenge of matching resources to those increasing missions. But at the top of the list are people. General McConville has made it very clear from his very first day as Chief of Staff that his number one priority is people. You've heard it, you've seen it, people first. There are myriad people issues confronting soldiers today, but none are quite so complex nor as serious as suicide. September is National Suicide Prevention Awareness Month, and we're honored to have joining us today to discuss suicide prevention and awareness Dr. James Hellis, Director of the Army Resilience Directorate. Dr. Hellis has been with us before, and we welcome him back to AUSA. For those of us joining today virtually, please take advantage of having Dr. Hellis here to ask questions. You can use the Q&A tab on the right-hand side of your screen to post your questions. And after the discussion, we'll take as many of your questions as time will allow. To moderate today's discussion, AUSA is honored to welcome back Lieutenant General retired Nadia West. General West was the 44th Surgeon General of the Army and the former Commanding General of the United States Army Medical Command. In 2015, she became just the very first African-American woman in the Army's history to achieve the rank of Lieutenant General. She's the highest-ranking woman to graduate from the United States Military Academy at West Point. She joins us today from West Point. She's a graduate of the George Washington School of Medicine and Health Sciences, where she completed residences in family medicine and dermatology. She's held various clinical, operational, and leadership positions throughout her more than 30-year career as a soldier. I was privileged to serve with General West in Europe. She's a soldier for life. She's the daughter of a soldier. Her brothers and sisters have served in the Army. Her husband is a soldier. She's the mother of a soldier. I don't know how you can be more of a soldier for life than Lieutenant General Nadia West. You can check out General West and Dr. Hellis's bios at the handout tab on your screen. And General West, I'm honored now to turn the microphone over to you. Thank you.
Well, thank you so much, General Ham. It's always a pleasure to be able to spend some time in any venue that you're a part of. Again, I appreciate having served with you as well and all my time in the military. So I just want to say thank you. And as you mentioned, I am joining you here from West Point today and have the pleasure of spending some time here with the Association of Graduates who so kindly offered a space for me to be able to do this webinar. And interestingly, the topic of today, suicide prevention and what we can do. Just wanted to do a quick plug for the Association of Graduates because, to borrow a Navy term, it's all hands on deck. Our HIMs grip hands with each other to reach out to those for help, asking for help, or to help someone else. And so I appreciate their efforts in this area. And as a healthcare professional, as you mentioned, as a soldier, anything that we can do to address this issue is extremely important. And so I'm really honored to be able to participate today. And I'm really honored to be able to introduce and spend some time talking with Dr. Hellis. And as you mentioned, Dr. Hellis is, again, another West Point graduate. Although, in our discussions previously, he mentioned that he was a superintendent, but of a different academy, of the Merchant Marine Academy. And so, rivalries in some areas, but when it matters, we're all part of one team in defending our nation. And Dr. Hellis, as you mentioned, was appointed to the Senior Executive Service in July 2012 and is currently serving as the director of the Army Resilience Directorate. And that's an extremely important role that we need in this in our Army and in our nation to help our soldiers and families. And in this capacity, establishes effective strategies, develops plans, and formulates policies for continued improvement of the ARD programs. And so he also works with the Army and the Department of Defense senior leaders to develop and execute short-term strategies for long-term initiatives to satisfy changing needs in a dynamic, evolving environment, supporting our soldiers and Army families. And so, Dr. Hellis, Jim, I really look forward to hearing your remarks and then having a discussion with you afterwards. And I really appreciate you taking time out of your very busy schedule to talk about suicide awareness and prevention. So I'm turning it over to you, Dr. Hellis. Thanks for joining us.
Thank you, General West, and thank you for that kind introduction. And to General Ham, thank you for the introduction, and thank you for the opportunity to return to AUSA and to speak out, to speak with and have what I hope is a dialogue between General West and me, but also more importantly with the audience on this very critical topic. So thank you for being here and for hosting this during Suicide Prevention Awareness Month. To be candid, we'll start off saying that suicide is a serious problem in our Army today, and it has been for several years. Every death by suicide is a tragedy. It's a tragedy for the soldier's family. It's a tragedy for that soldier's buddies, leaders, the unit. Any death, though, is a terrible thing for a unit, but especially a death by suicide. And so it's important that we get our arms around this problem, that we reduce suicides in the Army, because this harms soldiers, it harms units, it undermines readiness, and reducing suicide fits in with Secretary Wormuth and General McConville's themes of putting people first and making people our first priority. In this space, there are no easy wins, there are no quick wins, there are no easy solutions. Suicide is a complex phenomenon. Most suicides have multiple factors that lead into them, and we can at this point neither explain the persistent increase in suicides across the Army for the last 2 to 3 years, particularly in the active component, nor has science developed any way that we can predict who individually is at a point of contemplating death by suicide. So this is a difficult space to work in and difficult questions that we have to answer if we're going to get a reduction in suicide rates within the Army. We know the who. We know the demographics. The majority of deaths by suicide in the Army are younger soldiers, grade of E6 and below. They're men. They're typically in the combat arms. They have access to a privately owned weapon, which is used in the majority of suicides in the Army, and they have either singly or in combination financial, relationship, professional, meaning work or potentially UCMJ related problems, or behavioral health challenges, either singly or in some combination. But that doesn't tell us the why. There are many soldiers and young people who experience financial problems, relationship challenges, and the others, but the vast majority of them do not turn to self-harm. And so while we understand the who and some of the what, we don't yet understand the why. These factors that we cited are common among soldiers, they're common among young people. And one step we're taking is we're going to begin a deep dive into the last couple of years of suicide reports to see if there's anything that we've missed, if there's something that we're not seeing. We bring in an independent set of eyes to do that, to see if there's something that we can identify in the totality of the files to tell us this is why we're seeing this slow but persistent increase in suicides, again, particularly within the active duty force. Within the Army, there's a lot of activity that works towards prevention of suicides. Since last spring, the Vice Chief of Staff of the Army has met on an almost monthly basis with senior Army commanders to discuss the challenge of suicide, to discuss the phenomenon, to examine cases of suicide, and to share best practices across the force. It is an item of top priority for the Army senior leadership. But a lot of our programs, though, are not well synchronized, and we have to do a better job of organizing ourselves to holistically address suicide prevention. The People First Task Force, which was stood up in December in the wake of the release of the Fort Hood Independent Review, is developing models and tools for holistic prevention of not just suicide, but sexual assault, sexual harassment, substance abuse, and other challenges that face our people within the Army. We have many programs in the Army that can contribute to reducing suicide. When we talk about prevention, we're trying to move ourselves more upstream, more to the left of the boom, so to speak, in terms of the problem. We're trying to look at sources such as financial counseling, relationship counseling, parenting skills, substance abuse counseling, so that the challenges that we see that are reaching a crisis point when a soldier dies by suicide are addressed early, taken care of before it turns into a crisis.